ProMedica is a health system based in Toledo, Ohio. We service the area, 27 counties in Northwest Ohio and Southeast Michigan. We have 13 hospitals and over 400 assisted living and acute care rehabilitation centers. We joined forces with HCR Manicare about a year and a half, 2 years ago. And we do just about under 1 million studies per year. It was our CEO's objective to progress in a manner where we simplify our application use. So we've taken our applications, we've minimized the applications, and that started with our PACS systems. We have identified where we had redundancies in our PACS systems amongst radiology and cardiology. We decided that we were going to focus on having one PACS system for all ologies that produced images. So ProMedica decided to use one PACS system for ease of use for the end users. It was also an idea to have all images stored in one location, so we didn't have multiple PACS systems that didn't talk to one another. So having that one system provided us to minimize our application footprint and reduce our storage needs as well. When we decided that we were going to deploy this to the cardiologist, the Sectra PACS system to the cardiologist, we started at one hospital that we needed to transition off a historical PACS system. So we deployed it there. We built it out for the cardiologist for their liking. Then we introduced it into our central location, our larger area where we have more cardiologists looking at it. So ProMedica decided that we would start with echo imaging so we could provide our cardiologists with an opportunity to read remotely, which they didn't have the ability to do with our previous PACS system. So our cardiologists are always on the move. They always needed to have access to the system, and it integrated well within our EMR system. It was a priority for ProMedica to have one viewing platform. We had so many, again, redundant systems that we wanted to eliminate the redundancies and have one viewing option without all of the issues that we had to support the outside or the other applications. I'll actually quote a radiologist that we just had a conversation with. He was reviewing a patient's study. He had a CT study, and then they also had an echo study. So he had the availability of being able to see the echo ultrasound while also reviewing the CT study, and he identified an issue between the two imaging studies. Whereas if we had the two separate imaging systems, the radiologists wouldn't have access to those echo studies. So that was one of the benefits that we were trying to accomplish, is that we had all of our images in one place, so even the cardiologist and or radiologist could view the entire patient's history in one location. We're able to store, yes, all CT, ultrasounds, nuclear medicine, MRI. They're all, as long as they're all in a DICOM format, we can store them in the PACS system. It all started with the purchase of Epic. Epic was pretty much the push that made us go to one VNA-enabled PACS system to host radiology and cardiology. Once we established radiology and cardiology, then we expanded our opportunities to all the other ologies such as ophthalmology and endoscopy and any other OR imaging. So we built a system to allow for cardiologists to access the Sectra PACS and their cardiology applications anywhere at any time on a Citrix-based solution that we have 20 spun up instances of this desktop at any given time, so the cardiologists can interpret and review images in or outside the system. And it replicates just like a full reading workstation that they would have built in the hospital. So the way that it works is that a cardiologist will log into this, and it sections off one instance or one computer session for the cardiologist. He's able to do his work, he logs off, and that session is then deleted and rebuilt for the next user that logs in. Cardiologists, when we approached them about changing from their current PACS system to our new Sectra PACS system, they were less than enthused because they've homegrown their own PACS system. But once we introduced the functionality and the benefits of having a VNA-enabled Sectra PACS system, they saw the benefits of it. So we did have a cardiologist champion. We also did have our own Epic physician champions that approached the cardiologist on behalf of the team to ensure that we were going to build out the system as closely as what they were used to in their old PACS system. The biggest hurdle I think we ran into was the launching of the application. We worked with Sectra and TomTech to bypass the several clicks that the cardiologist had to use to get to an image. So we worked with the team to just be able to click on a patient once and then have it open automatically within TomTech. Training cardiologists on Sectra PACS was a challenge because they're always in different places all at once. And we would set a time up where they could visit us in a set location. We also provided on-site training and one-on-one training at their leisure at whatever location they were at. And we had Sectra pitch in and help get a lot of that training done as well. Having cardiologists buy into a new system is always challenging. It's the right thing to do. It's an important thing to do because if you don't have the cardiologist buy-in, the system will ultimately fail just because they're resistant to the change. We maintained all the new builds with the team that we have. So we had the Cupid team from the Epic side and then the Enterprise Imaging team from the Sectra PACS side. Sectra's really good with their customer support. They excel at customer service. Cardiologists do need to be able to access images in one location, and they need not just the echo studies or the nuclear stress studies, but they may need to look at a CT scan where they've looked at coronary arteries and found a blockage there so they can see on the echo where that heart is failing to pump correctly. So we are showing the cardiologists that this is the way of the future, that they need to move in this direction, and I think they're beginning to see it with us. So it's good.